Hi, my name is HLantz, and I'm going to share with you some information about my behavior change project. The student who I chose to do this project on is a second grade student in the general education setting. This particular student is a male and has a diagnosis of autism spectrum disorder. He was first diagnosed when he was in kindergarten and is now in second grade, as I said. He also has a diagnosis of ADHD, attention deficit hyperactivity disorder. He receives medication every day for the ADHD. He is fully included in the general education setting. He does receive some pull-out instruction from the special education teacher on a daily basis for reading support and social skills instruction. And again, that happens every day. He also receives some pull-out support from the speech and language pathologist and from the occupational therapist, and that happens on a weekly basis. This particular student has difficulty staying on task, requires a lot of redirection from the classroom teacher, and so there is a pattern of a lot of talking out behavior that has been going on in the classroom, and it's really disrupting the learning environment in the classroom, not only for the student but also for the rest of the general education students who are in the classroom. So that's the target behavior that I chose. So the definition of the talking out behavior is talking out during instructional times and independent work times when talking is not permitted in class without gaining permission to speak or raising a hand to gain permission to talk. And some examples of this would be talking out during math instruction, blurting out answers, talking to a peer. Some non-examples of this might be talking to a peer during transition times when talking is permitted, during group work times if talking is permitted. Those would both be non-examples of this. So what I did was I used an AB reversal design. During baseline collection, the student was observed in the general education setting over the course of the school day for 5 consecutive days. During treatment, the same type of data collection was implemented, and then there was a return to baseline for 5 days. And in order to collect IOA data, a paraprofessional was trained in the definition of the behavior so that both observers were aware of what behavior we were looking for. It was calculated using trial-by-trial IOA and then calculated as a percentage. The treatment fidelity, or the IOA, ranged from 80% to 100%, and it was also collected during all 4 phases of the ABAB design, and on 2 occasions during each of the 4 phases. And so the treatment, the actual treatment, or the intervention that I used with this particular student was actually more of a treatment package. So what I did was I created a social story, a hand-raising social story for the student, and that was read every morning by either a special education teacher or a paraprofessional every morning with the student. In addition to that, we implemented a token economy so that the student was earning stickers on an I am working for board when hand-raising behavior was displayed. And also, the student was allowed to have a 5-minute non-contingent attention time with the general education teacher every morning to just chat about any sort of topic of his choice. And that happened every morning before class began, so that he could have the teacher's attention that was non-contingent upon those stickers or anything else that was going on in the classroom. And so that was the treatment that was implemented during both the first intervention and then the return to intervention phase. Another important thing to note was that this student has kind of some perseverative interests in Angry Birds. It kind of dominates all of his thoughts and conversations. So that was what we used in the token economy. He earned Angry Birds stickers on his I Am Working For board, and then when he earned enough stickers, he was allowed to earn 15 minutes of time playing the Angry Birds game. And so to be a little bit more specific about the token economy, during baseline data, according to the data that was collected, the student engaged in talking out behavior a mean of 7 times per 30-minute classroom interval. And so then for each 30-minute interval, if he engaged in talking out behavior 5 times or less, he was allowed to put a sticker on his chart. And then when he earned 5 stickers, he was then allowed 15 minutes of time playing Angry Birds. And then, so after, I have a chart to show the results. There they are. So you can see that, oops, this is baseline, and then the first intervention, and then return to baseline, and then the second intervention. So the intervention did not immediately have an impact or was not effective immediately, but it did have, we quickly took a downward trend in terms of the talking out behavior. Some of the things that might be considered a limitation is that because this was a treatment package or an intervention package, it's difficult to really discern what was most effective in changing his behavior. Was it the token economy? Was it the social story? Was it that special time with the general education teacher every morning? In terms of generalization and maintenance data, I have planned to collect additional data 6 weeks from now. We're still implementing this intervention, and it seems to be continuing to work with this student because the talking out behavior has improved a great deal. But the generalization, I do not have the data to support it at this time. Thanks for watching.